Good Sunday morning, and thank you for joining us for News You Can Use. I'm Carmen Chow, and today we have here is Dr. Paul Chomiak, a thoracic surgeon from the Frederick Memorial Cancer Treatment Center. And Doctor, it's great to have you with us today.
Good morning, Carmen. Thank you for having me.
Now, I know November is Lung Cancer Awareness Month. Talk about why it's important to spread this message to the community.
Lung cancer is an epidemic not only in our community but also in our country. Unfortunately, more people die of lung cancer every year as compared to all other cancers combined, such as prostate cancer, colon cancer, and breast cancer. We know statistically that 1 out of every 6 smokers will unfortunately die of lung cancer. And when you look at the most common cause of lung cancer, 85% of the time it's related to smoking cigarettes. Not only primarily inhaling the cigarettes, but the smoke that is blown off into the environment to other people around you.
Now, I know there's a lot of technology out there that helps diagnose lung cancer screening. Talk a little bit about the advancements in that.
For years, we have been really limited in terms of the technology that we could utilize for screening. I think the best example of screening for cancer anywhere is breast cancer. That's been widely accepted. It's paid for by the insurance companies. And statistically, you actually have to screen 780 females in order to save one woman's life from breast cancer. But what's an interesting statistic is with the new technology of low-dose CAT scan screening. If you screen 320 high-risk smokers, you can save one smoker's life from dying of lung cancer. Just subjecting somebody through this screening trial will offer them a 20% chance of reducing their probability of dying from lung cancer. So the statistics for this have been very solid for many years, but unfortunately the technology is not currently reimbursed by either Medicare or by insurance companies. So at FMH, we took it upon ourselves to develop a lung cancer screening program. And we've offered this study at a $99 cost factor, which is actually a loss to the healthcare system, but it provides a wonderful community service for high-risk smoking patients.
Now, what kind of services specifically do you offer for those patients at your lung cancer center?
I think one of the most proudest programs that we have at our lung cancer center is the FMH Multidisciplinary Lung Cancer Clinic. Unfortunately, in this country, by the time a patient is diagnosed with lung cancer, and from that point on, when they're asked to go see various specialists and obtain various testing, that time frame can be as long as 3 months. At our program, which we host on a weekly basis, patients and their families are allowed to come to our healthcare system and be seen by a thoracic surgeon, a medical oncologist, a radiation oncologist, a nurse navigator. And in a very short time frame, after seeing that patient real time, we generate a treatment plan. That morning, the patient and their family receive that treatment plan, and we're proud to say in our data that in under 2 weeks, that treatment is implemented.
All right. So what prevention tips or safety tips do you want to give out to the public for people who are smoking or are suffering from lung cancer?
I think the most important thing you can do from a preventative method is to stop smoking. Now, of course, that's easier said than done. In the past, there have been some technologies such as patches and some pills and counseling, but in reality, only about 25% of the time were those modalities able to achieve success. There is a new technology on the market now, an electronic cigarette, which allows a user to gently wean the level of nicotine. And though this has not really been evaluated as a proper opportunity to wean patients off of cigarette smoking, I think it's an option that might prove to be useful in the future. In terms of patients who've been treated with lung cancer, this is a very challenging time because suddenly you're given all this information overload. You're giving a sentence that historically had a very poor outcome. A lot has changed in lung cancer management. And that's why through a multidisciplinary approach, we can determine what's best for that patient. Statistically in this country, when someone is diagnosed with lung cancer, 80% of the time that cancer is already advanced. If I can identify a patient ideally with a small tumor, I can offer them robotic technology either through our Da Vinci robot to surgically remove that cancer and potentially cure them, or if they're deemed high risk and cannot tolerate an operation, we can use technologies such as CyberKnife, which is a robotic stereotactic approach that can destroy that tumor with high energy X-ray beams. But for the other other 80% of patients who have advanced cancer. This is where working as a team approach with a medical oncologist, a radiation oncologist, and a chest surgeon, we can formulate the best probable chance to put that cancer in remission and hopefully cure that patient.
All right, Dr. Chomiak, thank you so much for this information. I'm sure a lot of people out there who are suffering from lung cancer would like to know this information. All right, and thank you for joining us today as well.
Thank you for having me, Carmen.
All right, and we'll be right back after this break.